TALK.
The world is looking at El Paso.
What will we say to the world? From the KELP studio in El Paso, this is 915 Talk.
And now your host.
Good afternoon, beautiful citizens of the borderland. This is 915 Talk, and I am your host, Andy Frecka. It is a blustery day in the borderland, and today we have Dr. Del Norte on the board. Dr. Del Norte, how you doing today?
I'm doing pretty good, aside from this dust.
It's a blustery day,
Very blustery.
And how does the dust affect your eyes, Dr. Del
goodness.
Norte?
Well, it makes them itchy, have a lot of allergies,
Yeah.
can't see properly.
Yeah, we're going to be talking eyeballs today.
Oh, nice.
Yeah, and that's why you're now Dr. Del Norte.
Dr. Del Norte.
Yeah, we're going to be learning. We're going to be learning a lot about eyeballs. So answer me this, Dr. Del Norte.
Okay.
What is an optometrist?
Oh, an optometrist. I have to go with the guess.
Okay.
Let me go with a smart guess.
Okay.
It's an eye doctor.
I thought you were going to say an optometrist is someone who only sees the sunny side of life, but that's actually an optimist.
Oh,
but our
right,
guest
right.
today is I think he's an optimist, but he's not an optometrist.
Okay.
He's an ophthalmologist.
Oh,
which is like cooler, I think. I don't know. No, I don't want to throw any shade at optometrists out there.
Yeah.
He's a cornea expert.
Oh, okay.
Yeah. Which part of your eyeball is a cornea, Dr. Del Norte?
The inside of the eyeball.
That's why we're going on this educational journey together on 915 Talk.
Yep.
We learn something new every day. You know,
Definitely.
we've had a few politicians on recently, so it's good to get back to medicine. It's good to talk science. It's good to talk about these bodies God gave us that are incredibly complex and amazing. And our guest today is not just an eye specialist.
Okay.
He's also a bit of a athlete.
Oh, wow.
Yeah,
Okay.
he's an avid soccer player. But more importantly, recently he won second place in a very high-level men's doubles pickleball tournament. And he would have won first place, except for his partner got totally gassed in the finals. But he's also a professional saxophonist.
Wow.
Yeah, because don't let the facts get in the way of a good story. He was a professional saxophonist. He came in and I said, "Have you ever been on the radio before?" And he said, "Not speaking." Oh. He was playing the saxophone.
No way.
Yeah, so we'll talk about that, but we'll be talking about eye care. He's an expert in dry eyes.
Wow.
Yeah, so we're going to be talking about dry eyes, something that affects us here in the desert.
Oh, definitely.
But a lot he works at West Texas Eye Associates. That's over on Loma Land, not too far from here. Mm-hmm. So without further ado, wherever you are, maybe you're out in Fabens or Anthony or Hatch, listening to 89.3 FM, 1590 AM up in Oro Grande, 95.9 FM in the beautiful city of Chaparral. Wherever you are, let's give a very warm borderland welcome to the one, the only, Dr. Samuel Faith.
Wow. I'm glad I didn't interrupt you guys. So many inaccuracies.
Yeah. So, Dr. Faith, welcome to 915 Talk.
Thank you. Thanks for having me.
Yes. So we have a lot to talk about, but I do have to tell our listeners that nothing we're going to talk about today is in any way to be construed as medical advice.
Certainly.
Yeah. If you have medical needs, you need to go and get a licensed medical professional who knows the specificities of your situation. Everything here is just two guys talking, informational purposes only. Getting that out of the way. The main thing I want to know is, Dr. Faith, is that your stage name or is that what's actually on your birth certificate?
No, that's a question I get asked quite often.
Yeah.
Because patients wonder if I changed my name.
Right.
Of course, they wondered that before when they knew that my dad was a missionary.
Right.
But no, that's our legitimate last name.
Okay. And doctor is your first name. I like that. Dr. Faith.
Yes.
But tell me, today is a blustery day. There's sand blowing around. It is May 13th, 2025, in case this plays again later. We're live at the moment on May 13th. How does this affect our eyes?
Man, it's actually, I've heard more times recently than in our 6 years living here that this is the worst year in terms of wind and dust storms.
Right.
In the last, who knows, maybe 80 years or so.
Yeah.
But it has great effects on eyes, especially in patients who already have a predisposition for dry eye syndrome or other types of inflammatory conditions. Really, it's a perfect mix of all the things that you'd want to avoid: high altitude, high UV index, high winds, high dust, and lots of allergens. Mm-hmm. This basically will irritate even the healthiest of eyes. It creates an inflammatory cascade, creates dryness, irritation of the surface of the eye. But for patients who already have a baseline of dry eye or allergies, or who are on certain medications that have those effects, like patients who have glaucoma,
okay,
the weather is just terrible.
Right. And so why would someone have a predisposition to dry eyes?
Well, first of all, and here in the border, the environment, like I say, it's just almost inevitable to not have some degree of dryness. Mm-hmm. Basically every single patient I see has different problems, but almost all of them have dryness.
Okay.
And it's, like I say, altitude, UV index, wind, and everything else, and the storms that we have that create this cascade.
Right. So on a day like today, should we be wearing sunglasses outside to keep the sand out of the eye, or what would you, or it's just useless,
really,
it doesn't help, or because it's so
sure.
much sand?
Certainly having eye protection, be it glasses or sunglasses, helps, but unless you were wearing swimming goggles, you're going to have dust and sand and debris that's going to hit you.
Gotcha.
And so, the thing to do is either stay inside if you already have a problem with your eyes, mm-hmm. or if you can't, then just try to be proactive about treating it once you're undercover.
Right. So I guess there's different reasons why someone would have dry eyes, but is there like a long-term solution, or is it just eye drops?
Well, eye drops are the long-term solution.
Okay.
Dry eyes is very similar to any chronic condition, where basically our goal is to treat it in such a way that patients can live their life without being debilitated by the symptoms that they have. But there's no true way of resolving the issue entirely.
That's could not be more disappointing to hear.
Yes. For you, maybe. Yeah.
So
for me, it's job security.
I got you. So are you like, if someone comes in with dry eyes, are you looking for what exact eye drops they need?
Yeah. And so one of the things that we do that's important is that we're trying to find what it is that specific patient needs and suffers from. What are the symptoms that bother them? What are the things that make their days less than ideal? What are the issues that they're having specifically? And then try to address those in a stepwise fashion. Okay. So, a lot of people, for example, they know that if they're having irritation or scratchiness of their eyes, they can go to any store, any pharmacy, they can go online and order drops.
Right.
And for some people, that's enough.
Right.
But for others, many of them who end up in my clinic, that's just the start. And so there's so much more that we need to do. And once again, it just depends on who the patient is, what the problem is, and how they experience it.
Yeah.
One of the issues is that treating dryness is something that requires a lot in terms of your routine. because most of the time drops have to be used frequently throughout the day.
Yeah.
And so people have to make changes in how they take care of themselves so that they can see the effects that they're looking for.
Right. So what you're saying is most people just go to the corner drugstore, they get some eye drops. That doesn't work, so they go to a doctor, and it becomes a little bit more focused and specific to their situation.
Absolutely.
Yeah.
Like, for example, one of the things we do a lot is we put plugs in patients' tear ducts. Some of these plugs are dissolvable. Some plugs are permanent. You can even cauterize the tear duct to close it so that the tears stay on the surface of the eye longer. And so all of these things are just, a step at a time, trying to get to where the patient wants to be.
Wait, so if you cauterize tear ducts, that will make your eyes more moist?
Yeah.
That's the opposite of what I would expect.
And that's what I hear all the time.
Yeah.
Every time we blink, our tear ducts work as a suction cup. And so they take the tear that is sitting on the surface of the eye on the lower lid, the tear film, and they suck it in down into the nose and into the throat.
Wait, hold on. So you're saying my tear ducts are taking moisture off my eye?
Correct.
Are you sure about that?
Absolutely. Yeah, so
I'm obviously joking, but I
is,
didn't expect that.
So we
I
have an upper and a lower puncta, which is the opening. And if you look at yourself really close in the mirror, you pull down on your lower lid, you'll see there's a little dot there.
Right.
That's the opening.
Okay.
And that does function as a suction cup. And so every time your lids touch, it sucks in those tears from the surface of your eye so that they go down into the throat. This is also why when patients are taking medicated eye drops, they're like, oh, it tastes funny in my throat. Or some people are like, oh, I really don't like the taste.
That's interesting.
Yeah. So your tears are produced in the lacrimal gland, which is up in the top on the upper lid.
Okay.
But they have to be recycled. You don't want tears that are just constantly sitting there unless you produce very little tears.
Yeah, I feel like this is, like on social media, people will be like, today I learned. I don't know where I thought the moisture on my eyeball was coming from, but it doesn't come from the tear duct.
No, it goes into the tear duct to leave the eye.
Where do my tears come from? Same place as from the
gland
upper lid.
It's underneath the lateral aspect of your upper lid.
Interesting. So you cauterize the tear duct, and it does the opposite of what you would expect.
Exactly.
And it makes your eyes more moist.
Correct. Another question I get asked all the time is, if I have dryness, why am I tearing all the time? Why are tears just constantly coming out of my eyes? And the reason is because your body is trying to help respond to the problem. You have a dry surface, your nerves are stimulated on your cornea, so your lacrimal gland produces more tears to try to have a positive effect on the symptoms that you have.
Huh.
And then that's why people tear. Yeah.
Wow. Okay. So I did not expect any of this. So that's dry eyes. Very interesting. Now, Dr. Del Norte at the beginning of the program was trying to say what the cornea was. How close was he, Dr. Faith?
I think his answer was it's something on the inside of the eye. So he was close.
Okay.
Because the eye is so small.
Right.
It can't go too far.
So he's like, it's something in the eye. That is correct. Yes.
Yeah. The cornea is the window of the eye.
Okay.
It's the outer surface of the eye.
It's the opposite of what he said.
Basically.
Yeah. Okay.
It's the outer clear membrane through which light comes into the eye. We can't see people's corneas when we look at them with the naked eye, but it is above the iris and the pupil. It's just a clear
so you cannot
window.
see the cornea.
Technically, you could say, if you know what you're looking for or looking at, yes, because, for example, when I'm looking at your eyes, I can see light that's reflecting off your cornea.
Okay.
But most people, when they think about what they're looking at and looking at someone's eyes, they think they're looking at your iris, the colored part of your eye.
Yeah.
But you're looking through the cornea and then through liquid that's called aqueous. into the iris.
Interesting.
Yeah.
I just have to share a little bit about myself on a personal note. I've never felt like my eyes are dry until we had this conversation, and I'm just wanting to blink all the time. I've never thought about dry eyes. It's interesting. So you're a cornea specialist. So what kind of issues do people come to you with?
Sure. So of course dryness is a big one, but and actually people come from all over to see me for dryness because we do all kinds of cool stuff. One of the things that, and I'm sorry this doesn't answer your question, I'll get to it, but one of the things we do that people really are surprised by is we make drops with their blood. It's called autologous serum, which means serum is a liquid that runs in the blood once you've removed the red blood cells.
Okay.
And autologous means it's one's
serum.
Own. We use this as a more advanced therapy for people who have severe dry eye, and it's amazing.
You create like personalized eye drops.
Yeah, I mean, people come, we draw their blood, we spin it, we take out their red blood cells, and then we mix the liquid, which is the serum, with preservative-free normal saline. Depending on the needs of the patient, you can do a certain percentage. Usually it's 50% or less, and then patients use those as drops for their dryness. And it's really amazing.
Are the drops transparent?
No, they look...
It's not
basically,
red, though.
No, it's a brownish...
Oh, wow.
Light brown liquid.
Wow.
Yeah, it's not clear.
That's interesting.
Yeah.
But you see better after putting it on your eyeball.
Yes, if you need it, it really helps.
Yeah.
So why do people come see me? So, corneal ulcers is something I see a lot of.
How do you get a corneal ulcer? If that's something a listener is interested in getting.
Sure. Probably the most common mechanism is related to improper use of contact lenses.
Okay.
So people who sleep in their contacts, people who don't get new contacts as often as they should, people who aren't properly fitted in contacts, which are a lot of people, or even, younger people who just buy contacts in like a gas station or something for a party. Oftentimes these are problematic. And so contact lenses are the primary cause of corneal ulcers, but there are many other causes. Procedures where you need to suture the eye closed, you can get an infection from your suture. Patients who have severe dry eye, they can get open wounds. The eye can get so dry that you'll get a small abrasion on the surface of the eye, and then that can get infected. There are just many different causes. Trauma, even some, actually recently I've seen something that's really uncommon, which is parasitic infections of the eye.
Oh, wow. And
they can be extremely difficult to treat.
How do you get a parasite on your eyeball?
Usually it's related to water. So some in their stories somewhere, somehow, almost always, there's something that has to do with water, either washing your contacts with water or washing your eyes out with water, and maybe you had
swimming in the Rio Grande.
Swimming is definitely one. Hot tubs.
Interesting.
Things like that. Yeah.
Thank you for unlocking that new fear in my life, Dr. Faith.
No, I mean these infections are crazy,
and
they can be so difficult to treat. Think of this: I was in France for Tosh, my wife's 40th birthday.
Okay.
And I was so excited to go to a pharmacy and buy drops that you can't get. Maybe I shouldn't say this on air, but you can't get them here in the States. They're not allowed through the FDA. It's a long story, but they are a legitimate, demonstrated treatment for these parasites, and patients just can't get them. Even if you have like a brother or a sister who lives abroad, if they ship them to you, they'll get stuck in some warehouse somewhere. So
interesting.
I did bring some just in case I have patients who have this. I can give them to them.
So these parasitic infections, Swim with your eyes closed. Yeah, I love to say, keep your head above water. And so we have all kinds of new fears unlocked. We have parasites.
You're welcome.
We have ulcers. What else do we have on
So
our eyeballs?
another reason patients come to see me is because they need a corneal transplant. And
Oh, wow.
there are many different reasons for needing a corneal transplant, and there are also different types of corneal transplants. But definitely one of the reasons you might need a transplant is if you had an ulcer that then led to a visually significant scar on the cornea.
Wow.
Yeah.
So where do you get the cornea from for the transplant?
That's a great question. So there is a incredibly sophisticated organ donating system here in the U.S. where there's no waiting list for corneas. I mean, there are for other organs, but anytime organs are harvested for donation from an organ donor, they always take the eyes. And typically, unless they've had a procedure that would preclude them from being a candidate, those patients' corneas are used to donate the gift of sight. And within, I can order a cornea for a case that like today I did 2 transplants.
Wow.
I could, every week I have them, and every week I let the eye bank know. It's a national system, and the corneas can come from any different city that has an eye bank.
Wow.
Yeah. So all over the country. Now, in bigger cities, oftentimes you have a relationship with the eye bank, and you try to use tissue that is from that city, just because these are nonprofits and it's helpful for them to have surgeons that regularly use the tissue. Mm-hmm. And that's the way it was when we lived in Pittsburgh. But really, it's amazing, and it's such a blessing. I have patients who come from Juarez who cross the border to get a transplant, and right now there, it's almost impossible.
Interesting.
Yeah.
Yeah, so there's an eye bank.
Yep.
Wow.
Yep.
And I guess the the cornea transplant has to be rushed pretty quick.
Well, yeah. So you have about 7 days from the time that the transplant is shipped to do the procedure.
Okay.
Now, internationally, they're a little bit more lax with the regulations as to when you can do the transplant. So if a cornea doesn't get used here in the States, oftentimes we try to place it in a different country where it can be utilized.
You just put it like on eBay or...
No, I mean, it's usually it's cornea surgeons who have relationships with the eye banks that say, hey,
Wow. I'm surprised that 7 days.
Well,
That's
I know,
a lot
it's a
longer
lot.
than I expected.
Yeah, absolutely. Actually,
Yeah.
in Europe, it's even longer because they have a different way of storing the corneas. But I don't want to nerd out too much.
Right.
But yeah, so for me, I have pretty strict regulations on what corneas I accept. And so basically, I want the patient who is having the transplant for that cornea to have been donated within less than 7 days.
Wow.
Because I was saying, from the time it's processed. So maybe that patient the donor passed a few days before that. So.
Right.
But yeah, it's really a huge blessing that that's available to us here. And even for emergencies, if I have someone who has like a perforated cornea and they need to have surgery the next day, I can call an eye bank, and most of the time, the next morning they'll have a cornea ready.
Wow. So
Yeah.
you did 2 cornea transplants a day.
Yep.
And I feel like Dr. Del Norte and I really have a lot to... We need to up our game. We have done 0 cornea transplants ever, but it sounds pretty complicated. But you're doing that. You're dealing with scars. Tell me about cataracts.
Yeah. I love cataracts, man.
That's your favorite?
Well, no, cataracts are interesting because I guess that's I don't know. Maybe cataracts are my favorite.
Yeah, okay. What's your favorite eye condition?
Well, I was thinking more of my favorite surgery.
Okay.
I would say there's a type of transplant that's probably my favorite, just because the procedure is so cool.
Uh-huh.
It's an acronym, but the name of the procedure is DMEC, which is basically a inner layer transplant of the cornea, the tissue is only 15 microns thick. And so
Okay.
it's really tricky technically to get this transplant. You have to get it to unfold inside the eye by just tapping on the cornea and creating fluid waves. And so it's
My
just
goodness.
so cool
Yeah.
that someone would even think of this to come up with the idea, and that it works is amazing.
Wow.
There are no sutures. You just put air in the eye and it sticks to the back of the cornea. But anyway, cataract surgery is cool because every surgeon, every ophthalmologist that is not a retina specialist, this is actually not entirely true. There's so many subspecialties in ophthalmology, but most ophthalmologists do cataract surgery, and certainly every single ophthalmologist has been trained to do cataract surgery.
Right.
And so for us, it's like a rite of passage. It's our bread and butter.
Okay.
But what's cool about it is that being excellent, being a phenomenal cataract surgeon is so difficult.
Okay.
Because you do the same step again and again and again 1,000 or more times a year. I mean, I do over 1,000.
You did 7 of those
cataracts.
today.
No, 11. And it wasn't a busy day. And then 2 transplants.
Wait, you did 11 cataract surgeries today and 2
Transplants.
of the cornea. Am I getting this right?
Yes.
Okay.
And 1 glaucoma procedure.
So
But
I
cataract
spe- I-
surgery
I-
is so cool.
I
and
spent
it's so
some
hard.
I spent some time in Russia, and there's this phrase, "Как скучно я живу." It's like how boring my life is. I didn't do any of those things today. So again, walk me through cataracts.
Okay.
Yeah.
So cataracts are the natural lens in the eye that with age and with time, protein changes happen where the lens becomes opacified. And so patients start to notice that they
Is that
have...
like from eating too much red meat, or where does that come from?
No, just it's age-related.
It's age-related.
Age-related. So it's basically like there's nothing you can do to avoid having wrinkles. There's nothing you can do to avoid having gray hair
Right.
or losing hair for some people.
Yeah.
The changes in our nails. And
Yeah. Who of you
the
by wearing can
structure.
add a single cubit to their stature?
Exactly.
Yeah, exactly.
So in the same way, age is the reason for developing cataracts.
So it's protein. What did you say?
changes
On the surface of
on the lens.
on the lens.
And the lens in the eye, the natural lens, which is called the crystalline lens, is behind the iris. And actually, this is another thing, and it's probably because back in the day, cataracts got so bad that people went blind from them. People oftentimes think that cataracts are a film that develops over the eye. And I think that probably comes from, like I say, years ago, where it got so bad that people thought they had a film over the eye, they couldn't see anything.
Mm-hmm.
Or if you looked inside their eye, you could see something white through the pupil.
Okay.
The cataract, like I say, is the natural lens in the eye that has changed with age in such a way that it affects the quality of vision.
Mm-hmm.
It degrades the quality of vision. Usually it is yellow in its tone, and then it gets darker and darker over time, and then sometimes eventually it'll get totally white.
So can I see this myself in the mirror?
You'd have to have a really bad cataract. The
Okay.
easiest way to see it if you were looking in the mirror is if you had a way to dilate your pupils. So if you
Okay.
could put dilating drops in your eyes
Yeah.
and you had a cataract, you could see it.
Yeah. Again, purely for informational purposes only, not in any way to be construed as medical advice. But this is super interesting. We totally forgot about taking a break because I have been
sorry.
enjoying. No, this is great. I've enjoyed nerding out about our eyeballs. If you're just joining us, we're with Dr. Faith. That's actually his real name. That's on his birth certificate, Dr. Faith. No, it's Samuel Faith. He's with the West Texas Eye Associates of El Paso. According to their website, they perform the most advanced cataract surgery in West Texas. And this is also our daily reminder that 915 Talk is a production and is of Desert Voice Media and is listener supported. If you'd like to learn more, you can visit desertvoice.media. That's the website, desertvoice.media. And you can also listen in for, you can click there. You can find out about past programs, listen in on those. We recently had Mayor Johnson in, County Judge Samaniego, Lots of interesting people coming in, and we're learning about our community. So again, I encourage you to visit desertvoice.media. We really appreciate you listening in and joining us in this journey. We're going to continue talking about corneas, eyeballs, eye disease, ulcers of the eye, all of this with Dr. Faith. But first, we have Charlie One on the phone. Charlie One, how you doing this afternoon?
Okay, Andy, before I get to the crashes that we have all right, I want to stress on these strong winds and dusty conditions that really you have to use extra caution this afternoon. I'm looking at I-10, Litrovino, Americas to Litrovino and I-10. Poor visibility here. We have a lot of dust, poor visibility, extra caution here. Another area right now is I-10 at Schuster, executive area. Any open area right now, these spots right now have some open areas, so a lot of dusty, poor visibility conditions. Then on the west side, we have a crash at Artcraft and Northern Pass, crash here. Upper Valley and Parrish, crash right there. In the Valley, Independence and Jesuit, we have an injury crash. So the main story I want to stress is use extra caution because we have those strong winds, poor visibility in a lot of areas. There's poor visibility in most of the areas. The ones that I stressed right now, Litrovino, Americas, those are just a very, very poor visibility. And Andy, this afternoon, we just have to use that extra caution right now.
Yeah, so Charlie One, we do have a eye specialist, an ophthalmologist in the studio today, and what you're telling me is your eyes can actually see what's on the road through the cameras, even with the blowing dust.
Well, I'll tell you what, the cameras can only see what they can see, I guess. I mean, they can't see through that dust, but they can't see those very windy, dusty conditions right now. And that's, as I mentioned before, the Litrovino, America, Zaragoza area, just very, what the cameras see right now, what they're looking at, what I'm looking at, is just very dusty, poor visibility right now. I'd say about maybe 2 miles right now, maybe a mile at worst, but 2 miles at best. But you just, the cameras are just, they're just looking at poor visibility right now. And also at I-10, I'm looking at I-10 at Schuster, around the bend there, around the mountain, poor visibility right there as you go through that Schuster Asarco area. So it's, but also also for the eyes, really be careful with the eyes because that dust is going to get in there in their eyes, and that's not good.
For sure. And Charlie One, would you say that the real antidote for a dusty day is daily menudo?
Well, if you're inside, yes, that's the answer. When inside, that menudo is going to really, perk you up, really make you breakfast of champions right there. It's going to satisfy you and maybe give you some courage to go outside and deal with those dusty conditions. But right now, inside, enjoy the daily menudo. And we've Rita Cafe, 3120 Traywood, and then maybe that'll give you the courage to go outside and you have to deal and battle those strong winds and windy conditions there, Andy.
Yeah. Well, thank you, Charlie One. We'll talk soon.
Thank you. Thank you, Andy.
Yeah, and we're back with Dr. Samuel Faith talking. He's over at the West Texas Eye Associates of El Paso. We're talking all things eye-related, and we were talking about cataracts. Dr. Faith today did 2 cornea transplants and was 11 cataract surgeries and 1 glaucoma. Mm-hmm. What time did you start?
7 a.m.
7 a.m. Man, you were knocking it out.
Yeah.
Yeah, and each time you have to be hyper focused.
Yes.
That's super interesting.
It is.
How do you maintain that focus?
I don't know. I think it's just the way God made me.
Okay.
And it's funny because sometimes I try to explain what my day is like, but unless you're there and you see it, I don't think you can wrap your head around how focused you have to be. And
right.
It's nonstop. And I have 2 operating rooms that run at the same time, and I just go back and forth from one to the other. My team is awesome, and it's really been such a blessing to work with them and to grow with them. But yeah, it's nonstop. You have to be hyper focused for every patient and every procedure, and you have to be a perfectionist because it's their vision.
Yeah.
And it's one of the, I would argue maybe, well, I don't know, but it's something that people hold, it's of such great value in terms
Right.
of just quality of life.
Sure, of course. So, Dr. Faith, one of the main reasons I do this program, 915 Talk, is so that I can get expert advice for myself personally, free of charge.
Sure.
So, I noticed a few years ago it was becoming difficult for me to read.
Uh-huh.
And I really didn't want to believe this was happening.
Sure.
And so this is embarrassing to admit, but it's just me and you and everyone out in El Paso and southern New Mexico listening right now. I essentially stopped reading. Or, I mean, I would read, but it would be small amounts. Even my daily Bible reading really suffered.
Uh-huh.
I was reading less and less because I was straining.
Sure.
And so what I did is I think what most people do. I just went to the store and bought reading glasses.
Uh-huh.
And it was mind-blowing to put them on and
Sure.
now I can see.
Yeah.
What would your recommendation be for someone who's going through that? Like, did I do the right thing or should I have gone to the doctor?
Well,
We'll start off with that.
Sure. I mean, you kind of put me on the spot here.
Yeah. I hate to do that.
You did the right thing. So in hindsight, your eyes are fine. Now you can read. Now
Right.
you can enjoy your quiet times and
Right.
actually see what you're reading. Should people, as they transition from their 40s up, go to the doctor when they are having trouble reading small print? Not necessarily.
Okay.
Most of the time, really, the issue is what we call presbyopia.
Okay.
Which
Presbyopia
is kind of a
we
sad
talk a lot
term.
about that.
Old
Yeah.
vision.
Old vision. Okay,
Yeah.
that is sad.
But basically, what's happening in terms of the eye itself is that your lens, that later on will become your cataract,
Yeah.
is no longer
Okay.
as flexible. And so these are the early changes that happen that keep us from being able to focus on a near target. We lose the flexibility of our natural lens.
Right.
And because of that, we now need
Is there something I can
reading
do,
glasses.
like, I don't know, stretches or something to maintain the flexibility of my outer lens?
No, unfortunately not.
So, okay. So, with that in mind, I have a friend. I won't give you his initials. His name's David Kaufman, and he said, "Ask Sam
Sure.
about sunglasses."
Okay.
And I wasn't really clear on why. So
Sure.
tell me about sunglasses.
he probably just wants sunglasses.
Well, I mean,
from our optical shop.
So, like, when we put them on, is it like, does it just make us more comfortable, or is it actually protecting the eye?
No, it's certainly protecting the eye.
Okay.
There are so many things that I see today that I treat that could have been avoided if we were disciplined about wearing sunglasses.
Interesting.
And like we were talking about before, dry eye is one of them. 60 years of living in El Paso
Okay.
without wearing sunglasses is going to lead to eye problems.
Okay.
No matter how you slice it.
Right.
I also see something that I do surgery on often that are called, the plural is pterygia.
Pterygia. We
Pterygia.
talk a lot about that around here.
In Greek, it means wing-shaped,
Okay.
and the singular, the diagnosis is pterygium. In Spanish, it's called, here people call them carnosidad,
Okay.
and basically means a growth on the eye. And I'm sure you've known people or seen people that have it. It's kind of like something white that kind of grows onto the eye here, and it gets beefy and red at times when it gets irritated. Here, that's super common, and it's all because of the elements: the wind, the dust, the sun, the altitude.
Right.
If people wore sunglasses when they're out and about, or if they learned how to wear sunglasses starting at a young age, these types of things can be avoided. I also treat patients who have growths on their eyes that are malignant.
Oh, wow.
And same thing. It's the toxicity of the elements over time that lead to that, just like having skin cancer.
Interesting.
So there are eye surface cancers that occur, and the primary risk factor is long-term exposure to radiation from the sun.
Interesting.
Yeah.
So I mean, you do recommend
Absolutely.
wearing sunglasses, it's not
All
just
the
a
time.
comfort issue.
No. Here in El Paso, really anywhere, but certainly in places like this, it is essential. And
Interesting.
it's
Yeah.
so important, and it's certainly not something that people probably hear enough
Right.
that they need to wear sunglasses. Even kids, as much as kids don't like wearing glasses, if they learned how to wear sunglasses when they're young, they'll do it for the rest of their life. They'll
Yeah.
avoid a lot of these issues. And cataracts certainly develop quicker in patients who have had a lot of exposure to the sun.
Interesting. So what I'm learning is don't go outside. Don't go swimming.
Stretch your lens.
Stretch your lens. Yeah. It's interesting for me because when I lived in Russia, it would become extremely cold and the snow would be blowing in my eye and like fine like ice,
Yeah.
and it would strain my eye. Then I moved here to the desert,
Sure.
and my first job was knocking doors out in the sun. And one of the things you want to do is you want the homeowner to see your eye. Because if you're just there with
Yeah,
sunglasses,
giant sunglasses.
It looks like, I don't know, like
Sure.
there's a question of trust there.
Of course.
And so I was always taking on and off my sunglasses and just feeling that pressure on my eyes. So what you're saying is, I mean, it's not just a comfort issue. It does affect us later on.
No, yeah. It's not a fashion statement. It's not for feeling more comfortable. It's not so much to reduce symptoms like glare and light sensitivity. All those things are great and true, but it's more about protecting your eyes for the long term, just
Wow.
like you put on sunscreen.
Wow. Okay.
Yeah. I would say it is equally important. As much as people love and know that they need to wear sunscreen, they should be wearing sunglasses.
Wow.
Yeah.
Okay. That's good to know. What other tips would you have just for eye care in general?
Man.
Or is that the main one?
Actually, if people took that piece of advice, I think that would be a really great take-home point. I get asked a lot, is there anything that I could have done to have avoided getting glaucoma or to have slowed down the rate of progression of certain eye issues? And oftentimes the answer is no, not necessarily. It's not something that you did wrong. It's not that you weren't careful. But, I would say maybe some of the basic things that people probably already know is if you're a diabetic, if you have high blood pressure, if you have any family history of eye conditions, get your eyes checked. Even if it's just once, have someone that you go see that is an expert that can give you a overview of what your eye health is and what it should be for your future. Even if people did that just once in their midlife, it would make it would have an impact on preparing for when people really start to have more common eye conditions.
Right.
And I don't think that's really a great sacrifice nor something that would be hard to do.
Okay. So if you just joined us, we're with Dr. Faith of West Texas Eye Associates. He's here in El Paso. We're talking about our eyes.
It's funny, man, that this is what we're talking about. I could talk about eyes all day. And of
that's
course I
great.
do it all day,
right.
but I love it. you know?
It's so great. We're about to take a break, and then we'll be back. We'll continue talking about eyes.
Sure.
Do not touch that dial.
We'll be right back. Don't touch that dial.
Testify.
I want to give God all the honor, all the glory, all the praise. There was a time in my life that I was lost in drugs, using and selling, living a sinfully life for 24 years of my life. I was empty, full of hate, anger, bitterness, selfish lies, and perversion. God saved me by His grace. I'm no longer empty. I'm no longer lost. He changed my mind. my heart, and my behavior. I'm no longer slave of anything. Today I know that there's power in the name of Jesus. Today I know that there's purpose. Today I know that I'm fearfully and wonderfully created to make impact through Him, to speak truth, to serve, to give, to love, to forgive, to be kind, to have accountability, to preach by example, and to always know that the victory is His. His will be done. My name is Lev Davidovich. If God can do this for me, He can do it for you.
And they overcame him by the blood of the Lamb.
And by the word of their testimony.
desertvoice.media.
Hey 915 Talk listeners, streaming worldwide.
We start looking at biological systems and approaching them from an engineering standpoint.
And he had a tiger as his pet. That little boy was me. From Mafia Princess to God's Princess.
You hear about God, but you don't ever see God. Jesus was there all along.
Desertvoice.media.
Christians are called to be ambassadors of truth.
Okay, let's learn to love our city, love our neighbor, and give God all the glory. This has been 915 Talk, broadcasting every weekday from 4 to 5 p.m.
This is Pastor Steve Castrita. I'd like to extend the invitation for you to join us in service every Saturday at 5 p.m. at Redeeming Grace Church, El Paso. We are located at 2400 George Dieter inside Iglesia Philadelphia. We're a young church on the east side of El Paso with no smoke, no lasers, and no gimmicks, just the uncompromising Word of God and a call to win the 915 for Jesus Christ. We'd love to meet you and your family. God bless you, and thank you for listening to KELP.
We're back. You're listening to 915 Talk.
We are back here listening to 915 Talk. We're here with Dr. Faith. He's over at West Texas Eye Associates here in El Paso. And before we went into break, Dr. Faith said he could talk about eyes all day. And that's true because we talked about them throughout the entire break. So one of the things, no, that's all good. I love, I guess, nerding out about these things. Yeah. I love this idea that our listening community can get excited and interested in things that maybe they don't deal with every day. Sure. Let's just kind of broaden our horizons, learn about all these things, because we are faith-based radio. We believe that the earth is the Lord's and everything in it. And so it is fun to learn about everything. Yeah. I did want to ask you this. I read somewhere, I was listening to a podcast or whatever it was, and they said that the eye is part of the brain.
Yeah.
So tell me about that.
Sure. Retina tissue is all basically the capturing cells that create the stimulus to form an image. Okay. And basically, the image enters in through the cornea, gets refracted through the lens onto the retina, and retina tissue is brain tissue. They send the electrical signal through the optic nerve, which is also brain tissue, right, into the brain, and it goes all the way across the brain to the back where it gets processed. In terms of systems, more of our brain is used for processing images than anything else. Right. And so certainly the eye, like I say, starting at the retina, if you're being specific, that's brain tissue, brain matter. It's sending electrical signals through the entire brain. Wow. And like I say, so much of the brain is involved in visual processing.
Interesting. I mean, it's the same as a computer. If you're editing a video, it takes a lot longer than audio, for example. Yeah. That's interesting. You see the complexities of all of this. I'm going to put you on the spot. Sure. How do you see evolution and science and how all of this came to be?
Sure. Man. Well, as you know, I am a Christian. I believe that we are created by a creator who is all-knowing and extremely complex in the way he has made everything really that is alive. And the eye is certainly a testament to his creativity and the complexity of who we are as his creation. If you study the eye as a individual your whole life, you will never know everything there is to know about this one organ. And that is so true that there are 8 subspecialties within the eye itself, where people don't just go to medical school and residency, they then do a fellowship just to study one specific portion of the eye, which of course is what I did with the cornea.
Right.
And I could have done years of that and still continue to learn more and more and more about just the cornea, which is a clear membrane.
Right.
But the eye itself is unbelievably complex.
Wow.
So where do I see evolution in that? Maybe basically nowhere. Honestly, I don't see in nature or through history or through the science that we know a example of a creature who has an organ that has gone from nothing to so sophisticated that it can't be studied in a lifetime.
Right.
I just don't see that.
Yeah.
So, that is my understanding of the eye as a subject that I spend all my day thinking about.
And talking about.
Yes. Like I say, I could talk about eyes all day, and I love doing it because I do that all day.
Right.
But it is extremely complex. And there's so many things where patients will ask me, why is this happening? Or what is this? Or how do you explain this? And the answer is we don't know.
Right.
Why does this laser that you're going to do to lower my pressure, to treat my glaucoma, how does it work exactly? And the answer is, well, there are 3 different theories on how it exactly works, and we don't actually know which one is the correct one.
Yeah.
And that's true of so many things. And the way I do cataract surgery today is probably going to be looked at 20 years from now as, wow, how barbaric. Just like when I look back at the Academy of Ophthalmology books on how they did cataract surgery, it was crazy. It's so different than what it is now. But
interesting.
Our skills are certainly changing. Our understanding and knowledge of the eye is growing, but the eye itself is a great example of a creator who is infinitely complex.
Wow.
And if I could explain him, he wouldn't be worth believing in.
Love that. Dr. Faith, one of the questions I like asking guests, because we have so many people come in who are doing so many interesting things, is this. You know how when you go to the circus and you see an elephant standing on a ball balancing himself, and then he has his trunk out and there's a guy balancing himself on the end of the elephant's trunk, and that guy's blindfolded and he's juggling flaming swords? And you know what I'm talking about. And you're there at the circus.
I don't know if I do.
and you're sitting there at the circus and you're looking at this guy and you're like, how do you get into something like that?
Sure.
So some people become proctologists.
Sure.
So why did you choose the cornea or ophthalmology or eye care?
It's kind of a long story, but I'll do my best. So as you know, I grew up in Spain.
Right.
My parents were missionaries there.
Yeah.
I lived there my whole life. I moved to the States when I was 19. But one of the blessings of growing up in Spain was that I was able to study music with my brother and sister in the conservatory there.
Wow.
And it's just set up in a way, it's probably the same in Russia, but it's set up in a way that it's public, the government funds it.
Right.
And you basically have access to professional level classical and jazz training that you can do from age 6 to age 22. And so all 3 of us did that. Some of our good friends who were neighbors, their kids that were our ages were in the conservatory as well. And at times we would carpool. And the dad, Pepe, was the chairman of the ophthalmology department of our university hospital in Cáceres, Spain.
Wow.
And it's funny because he's such an awesome guy, and we're still good friends today, and he's such a great mentor. and really an amazing ophthalmologist who's very gifted. But his desire for me was that I not go into medicine, but that I continued my passion for music, because he thought I was gifted at it and that I loved it. And I did, but I told him when I was about 16, he was asking me, so, you know, what do you think you're going to do? Are you going to go back to the States? Are you going to stay here? Are you going to study music? And I told him, you know, I'm thinking about doing medicine. Mm-hmm. And at the time I had a different idea of what I was going to do with medicine, but he was like, well, you know, are you sure? Why don't you just stick with music? You know, and both his kids did.
Right.
And they're professional musicians now.
Wow. That's cool.
But he was like, okay, Sam, so you want to be a doctor. You don't know anything about medicine. Why don't you come and watch me do surgery at the hospital? And so one summer morning, I walked over to his house and we hopped on his cool Harley Davidson and drove into the hospital. And he let me not just watch him do surgery. He let me help him do surgery. And I scrubbed in. I was 16. I mean, obviously, this wouldn't happen in the States, right? But he is an artist. I mean, really, he drew out the eye for me. He explained what we were going to be doing. I still have the notes from back then in a little notebook. But watching him do cataract surgery as a 16-year-old, to me, was just mind-blowing. And it was such an awesome picture of what medicine could be like in my life. And that was what got me wanting to follow this career path. And ever since then, really every year from that point on, while I was still, you know, while my parents still lived in Spain, I'd go back and work with them. I worked with his residents when I was in college. When I was in med school, we wrote papers together, and his dissertation is sitting on my bookshelf in my office. So that was kind of what ignited that fire that has continued to burn. Right. Yeah.
Very cool. So it started off, you're a missionary kid in Spain, and your carpool driver was an eye surgeon, and you were able to join him there in the operating room. That's pretty cool. I don't know if I'm putting you on the spot or not with my next question, because I actually have no idea how this works. West Texas Eye Associates, like, you accept insurance?
Yeah, we accept everything.
Okay, and then like Medicare and all that, does that work?
Medicare, Medicaid. Okay. We take basically every insurance out there. Yeah. Right. Actually, one of the cool things about our practice is that we really serve a broad range of people in the community, but most of what we do is not, you know, procedures that are trying to get people out of glasses or cash pay things. It's more just taking care of the very basic and general eye conditions of the population.
Right.
Yeah.
Very cool. Very cool. Today we've been with Dr. Faith of West Texas Eye Associates. The hour has flown by. We could keep on talking about eyes, but we're out of time. Sadly, I had a question planned. I was going to ask you, let's see if you can answer it quickly. You played the saxophone in the metro in Paris, the subway. Yeah. What is the #1 song to make the most money when panhandling on the saxophone in the metro in Paris?
That's a good one. Kenny G. Yeah, people love Kenny G.
People love Kenny G. Love it, love it. So again, thank you for coming in today, Dr. Faith. We've been with Dr. Faith talking eyes this whole hour. If you missed the first part of the program, you can visit desertvoice.media. This conversation will be available in podcast and YouTube format. And as we always say, let's learn to love our city, love our neighbor, and give God all the glory. This has been 915 Talk. You have been listening to 915 Talk, a production of Desert Voice Media. In order to listen to previous editions of 915 Talk, just visit desertvoice.media. Let's learn together to love our city, love our neighbors, and give God all the glory.